O NaCl, exemplo clássico de composto iônico, ao ser adicionado à água, sofre uma dissociação. Isto ocorre devido às interações entre as moléculas de água e os íons Na+, e Cl-, que formam o retículo cristalino do cloreto de sódio. Os hidrogênios da água interagem com os ânions cloreto, Cl-. Os oxigênios da água interagem com os cátions Na+.
my name is Debbie Bruck, and I am the founder of Homeopathy World Community. And today we're going to be talking to the Drs. Banerjee, and you'll have to help me with your first names, who have come from India all the way to Buffalo, New York, to speak to a very large group of homeopaths and other health professionals to teach about their protocols.
And we have working jointly with my son, and we attend in our clinic more than 1,000 patients a day, and we have made some observations and protocols which is known now all over the world as the Banerjee protocol of medicines, and we are doing a lot of research works, and a lot of research works are being done in USA with the collaboration of the most famous institutes like MD Anderson Cancer Center, like National Cancer Institute of USA. Then we like to make homeopathy popular and scientifically established throughout the world.
Well, I have a question. You say that you see 1,000 patients per
day.
Yeah. That is unfathomable for me. So how many professional, physicians, their MD homeopaths are looking at treating these people?
Yes, we have got qualified homeopaths in Calcutta who are looking after this. Pradeep, my son, myself, we have got another 14 doctors. We jointly see all these cases, and we have made an institute of homeopathy in there.
It's well recognized by the government.
Yes, it is well recognized by the government, and our research also is recognized by our government.
By the United States government as well.
Also, as well, United States government as well.
But we never hear about it.
And homeopathy is a complete treatment. It is not an alternative treatment. It is a complete treatment. Independently, it can cure diseases. And in India, homeopathy is fully recognized by our central government as a normal stream treatment process.
I'm going to ask you another, it's kind of controversial question, because in essence, I know places like the UK, we're not really even allowed to say what you just said.
In UK, it is fully recognized by the UK government. It is under the national scheme. The Queen of England and the royal family has their homeopaths. And treated in England, it is establishing. Because you see, when we are doing homeopathy, we search for everything good in this world. We try to know the conventional treatment. We try to know what is happening in the world. But very sorry that conventional people, they don't like to know these things. They should inquire these things. They should like to know what is homeopathy, if it's really doing good or not. We have done these works in MD Anderson Cancer Center, and the research works that have been published internationally. After that also, if they say, it's not good, lack of knowledge.
But for the benefit of mankind is some case presentations. For the vast number of cases under our treatment, we like to present 7 cases which are considered to be incurable by any form of oral medication currently available in conventional medicine. In our research foundation, we have treated these cases using only homeopathic medicines, and the following part of the presentation will show the results. Now let me show the details of the cases. There are 2 patients suffering from esophageal carcinoma. Esophageal means in the food pipe. Were treated with homeopathic medicine Kondurango 30C, prepared from Macedonia Kondurango, and the radiological plates and histology slides were kept for reference. There has been no evidence of recurrence of or metastasis in them. The patients are of good health. You see, this is the case that this is esophageal laltania. Here, there is a cancerous growth which has restricted the food pipe completely. There is no food coming after that. And there is a biopsy by the endoscopic biopsy which resulted in the as a squamous cell carcinoma. And this is a biopsy slide, so proving that it was a cancer. after undergoing treatment with this medicine, you can see that this growth has gone. It has come completely. It has completely. There is another case. There is a better photograph with that also. And the next case was another lady of 75 years, suffering from 2 months with difficulty in swallowing. In the same case of bronchogenic carcinoma, treated with the same medicine as Kondurango. You see, this is a very. You see, this was here. This completely choked, and the next one. You can see treated with that. This is the biopsy slide. These two cases were verified by the NCI in our presentation with the Cancer Advisory Panel. They verified all these cases, these two cases, and you see, this is completely free. They examined all pathology, histopathology, and all the plates and everything in the National Cancer Institute to be certified that these are the real cures. And these patients are still alive. ছোট করে দিচ্ছি বুঝলে এগুলোকে this is maybe doctors can understand this. It's very difficult to understand how these plants work, but the regression of, we are now trying on to know the details of these compounds, how it acts on the human case, but this is a clinical verification, has been certified and seen by the best authorities in the world today. Next you will see some brain cancer cases, just can you show some brain cancer cases.
So I'll just take over from here, right? Intracranial space occupying lesions. I think this is more of interest to you all. Incidence of brain tumors of its meningeal coverings and of the spinal cord ranges from 11 to 19 per 100,000 population. About 1/2 of brain tumors are primary lesions derived from neurons, glia, or their supporting meningovascular structures. The remaining are metastatic lesions. As per traditional methods, treatment of brain tumors include maintenance medical therapy, surgery, radiation therapy, chemotherapy, and immunotherapy. In many cases, surgical removal of the tumor is impossible, and in such cases, sometimes partial resection is effected. Response to radiotherapy and chemotherapy is poor in many cases, and in a good percentage of cases, their administration is contraindicated. There are recurrences in many cases, and the good many cases show poor prognosis. In our research foundation, brain tumors are treated successfully with homeopathic medicines. In our long clinical experience, we could give relief to a large percentage of cases, some of which subsequently exhibited complete regression. In this presentation, a study of 2 cases treated by us have been offered, utilizing all medical reports and information kept documented over the years, including the CT scans before and after treatment.
Excuse me. I had some people saying, could you stand up? Sir?
Oh yeah, sure.
They could hear you.
Sure. Sir, can you help me with the thing?
I'm sorry.
No, that's fine. Actually, I was going to control that as well.
I'm bad in computer.
Yes, in this presentation, a study of 2 cases treated by us have been offered, utilizing all medical reports and information kept documented over the years, including the CT scans before and after treatment. The cases have been treated by the medicines Ruta 6 and Calcarea phosphorica 3X. FY, female, aged about 27 years in December 1990, was suffering for 4 years with occasional attacks of headaches, that is since 1986. She had severe attack of headache worse on the left side on the 17th of December 1990 with a fainting spell and hazy vision when she came to us for her treatment on the 29th of December 1990. Clinically, the patient presented with haziness of vision, pain and weakness of the right side. Next slide, sir. The CT scan of the brain dated the 25th of December 1990 showed the most significant abnormality is the presence of a mixed attenuating hypo and hyperdense well circumscribed mass at the supracellular and intracellular region, producing marked expansion of the cella, slightly more on the left side. The fairly large mass, about 2.2 centimeters into 3.54 centimeters into 3.37 centimeters vertically as maximum dimensions. The radiologist had a doubt whether it was a craniopharyngioma or a pituitary macroadenoma. Next slide, sir. After undergoing treatment from us with the medicines Ruta, Graveolin 6C and Calcarea phosphorica, the haziness of vision improved from the first month of commencement of the treatment, and vision has been completely restored now. Pain and weakness of the right arm completely recovered. She is now healthy and normal and enjoying life. Next slide, sir. The CT scan of 27th of April 1992 showed follow-up case of a fairly large intracellular mass with predominantly supracellular extension, now showing complete disappearance of the inhomogeneously enhancing mass, leaving behind normal appearance of the pituitary gland and supracellular cistern since the last scan done on the 25th of December 1990. Next. So we can see both the scans together with the presence of the tumor, and that is a clean scan. There were no complications during the treatment. The husband of the patient visited us on keeps on visiting us at the clinic and bringing other cases to us, and even recently we have heard that she is absolutely fine and there has been no recurrence. So this is 1999, so this is 2007, so many years have gone. The next case is a 60-year-old gentleman who came to us on the 3rd of August 2004 and presented with a gradual weakness of the left side of the body and limbs, sleeplessness, irritability and easy anger for 2 months. Before coming to us, as per his initial observations, next slide, sir. Yes. The CT scan was done on the 20th of July 2004 and showed a multicentric glioma. Next slide, sir. A stereotactic biopsy was done on the 29th of July 2004 from the right internal capsule. It showed a high-grade neoplasm glioma. The CMC Vellore Hospital in Madras, in Vellore, India, gave a report which suggested corpus callosum and right parietal periventricular high-grade glial neoplasm. Next slide. After undergoing treatment from us with the medicines Ruta 6, 2 doses a day, and Calcarea phosphorica 3x, 2 doses a day, all his clinical symptoms were gone within 7 to 8 months. Until now, the patient is leading a trouble-free, normal life, but still continuing his medication. Next. CT scan done on the 16th of April 2005 showed hypodense areas and calcification in the right frontal region as compared to the previous CT scan of the brain done on the 21st of July 2004. The mass has almost resolved. Next slide, sir. So here we see both the slides together, and we see the tumor is there here, and we see that only a calcified focus is left behind.
In these cases, no chemotherapy, no radiotherapy, no surgery. Nothing has been done.
Right. We are still reviewing the case every 6 months, but there has been no recurrence. Rutin, the active ingredient of Ruta, is known for its antioxidant and its anti-inflammatory activities, and also for reducing oxidative damage in the rodent model. In addition, Ruta is also known to protect from DNA strand breaks and to prevent mutagenesis. Calcium phosphate activates phospholipase, which cleaves a compound, a membrane-bound molecule that activates protein kinase C. Thus, one may consider these aspects for a possible explanation of the effects of these medicines. So now we have some other cases which we have in this presentation. They constitute 2 bronchogenic carcinomas. So we'll just skim through these cases since they are not so interesting to you. So can we go to the next slide? So this is a case of a gentleman who is 47 years old, who had a chest pain and a cough, and an X-ray was done. So next plate, which showed a malignant growth occupying the left lung, upper part of the left lung. The growth size was 8 centimeters into 6.4 centimeters, so that's pretty huge. And an FNAC was done, a CT guided FNAC was done, and here's the mass. Okay, so and here's a plate which showed that it was a malignant tumor. We can see the masses here. And a needle biopsy FNAC was done, which showed that it was a malignant tumor. That is a large cell tumor. So subsequent X-rays with the treatment on showed a progressive reduction in the size of the next slide, sir. So we can see it progressively getting smaller until we go to the place where the tumor has completely disappeared. So this is actually NCI slide. The National Cancer Institute reviewed the case, and this is how they constructed the case for the best case series presentation. So let's go forward, sir. So these are the medicines that were used: kali carbonicum and ferrum phosphoricum. And the last CT scan and the last X-ray was actually done in '99, which showed there has been no recurrence and complete resolution of the tumor. So we can see progressively that the tumor is here, little better, more better until it is gone completely. So similarly, we have one more case of bronchogenic carcinoma, which I think we'll just go through the slide. And so here we see the tumor is there.
Correct.
There's a tumor, and there's a CT guided FNAC which was done, and there's a small cell type of carcinoma, and this is the subsequent plate. Next slide, sir. Improved, and this is also an NCI reviewed case. So let's go forward, sir. So these are the medicines, the same medicines as used in the previous case, and there is complete regression of this of the growth. So we see here progressively how the growth has disappeared. Okay, this is an interesting case. I think you may have seen this in the other presentation which was on the internet. Al has put it up already. But this case is very close to our hearts because see, it was a small child of 8 years who had a swelling in the left knee and could not bend the knee. So they took the child to the doctor and they diagnosed an osteogenic sarcoma which has eaten away the bone here. So they did a biopsy which showed it was a poorly differentiated sarcoma. The patient was treated with symphytum, calcarea phosphorica and carcinosinum. Actually, when the patient was taken to the hospital, the doctors advised above the lesion amputation of his leg. So subsequently, repeat X-ray was done, showed partial remineralization. You can see that it started to heal. And subsequently, another X-ray was done for 14th of August 2004. Could you have the next slide, sir? So if you see the three slides together, you see how homeopathy works. Homeopathy works as if the disease hasn't existed before. You see from here, where the bone is eaten away, the bone has reconstructed itself. It's reconstructing, and subsequently here it is completely like new. So these are the cases that we have for you. I'm sorry, we have a lot of cases with us, if you would like to see, but we can go on forever. And we have lots of brain tumors, as has been put up on Alex's site as well. So they are actually all accessible to you. In the end, we'd like to show you our clinic, which is in Calcutta, and there's a team. So who was saying that who's the genius here? So these are the people who actually help us, and it is because of them that we are prompt and we can help so many of you. And of course, thank you for allowing us to talk. Now we can answer any questions that you may have.
What is cancer? Contrary to what many people believe, cancer isn't just one disease. There are more than 100 common types of cancer and many more subtypes, which can occur anywhere in the body. Sarcomas are cancers that originate in muscle, fibrous tissue, or fat, known as soft tissue sarcomas, or in bone and cartilage. Leukemias are cancers of the blood cells, arising in the blood-forming organs, bone marrow, and the spleen. Lymphomas affect the lymphatic system, a network of vessels and nodes that acts as the body's filter. There are at least 30 and perhaps more different types of lymphomas. Carcinomas, the most common cancers, arise in the body's organs. About 80% of all cancers are carcinomas. Examples are cancers of the breast, prostate, stomach, colon, and as the skin is an organ, also include squamous and basal cell skin cancers. There are a few cancers that don't fit into these major categories. Melanomas, for example, are not considered carcinomas even though they arise from skin cells, and certain types of brain tumors have their own classification. Cancer begins in the body's cells. All parts of the body, organs, muscles, skin, even bones and blood, are composed of cells. Cells are constantly dividing and multiplying to replace old, damaged cells. Dividing is part of a normal cell's lifespan. Cells grow, divide, and die in an orderly fashion. However, if this orderly process is disrupted and cells begin to grow out of control, they form excess tissue known as a tumor. In most cases, tumors are benign, meaning that they are not cancerous. Benign tumors can occur almost anywhere. Although they may cause some health problems depending on their size and location and may have to be removed, they are usually not life-threatening. However, if cells are cancer cells, they grow, divide, and eventually form malignant tumors. Malignant tumors, unlike benign tumors, invade and destroy surrounding tissues and nearby organs. Eventually, cancer cells break off and spread through the blood or lymphatic system to form new tumors in other parts of the body. This process, the spread of cancer from its original site, is known as metastasis. Cancers that originate in the breast or colon, for example, typically metastasize to the brain, lung, liver, or bone, forming new tumors there. Metastasis can be a slow process, occurring over a number of years, or can happen rapidly, within a few weeks. Scientists are not sure why. Left untreated, cancers continue to grow, invade, and spread, taking over and destroying the organs where they originate, as well as those to which they spread and metastasize. As this happens, the person will eventually begin to experience symptoms related to the organs affected. To understand what causes cancer to occur, we must look deeper into the cell, at the genes that control the cell's growth and behavior, and how the cell's normal function may be disrupted or damaged. Since it is the genes that regulate the normal, orderly behavior of cells, abnormalities or damage to cells' genetic components cause them to behave abnormally, to become cancers. In some cases, people have inherited genes that may predispose them to cancer, while in other cases, genes are damaged by external environmental factors, such as smoking, exposure to chemicals or ultraviolet radiation, and perhaps even viruses. Not all of the causes of genetic cell damage are known, and in many cases it's probably not one, but a combination of factors.
There are still many unknowns. Research has unraveled many of the mysteries of cancer, and new discoveries are happening every day. The more we learn about cancer, the more targeted and specialized our therapies are becoming. There was a time, not too long ago, when a diagnosis of cancer was perhaps the worst medical news you could receive. But today, if you or someone you love has cancer, It's important to remember that many cancers that were once fatal are now curable, and many more are treatable than ever before in history.
So now we can to get into the more important questions. You talked about a little girl today. I don't name it now because of the privacy. 1.5 years old. My very first question was, why gets a 1.5-year-old child cancer? For myself, I asked myself. So I would like your opinion about where it comes from. Does it come from the pregnancy? Does it come from a very hard or complicated birth, or insured in the very early childhood by the parents? So what is your experience about it?
Well, concerning this particular case, and most of the very early cases in pediatrics, it is certain that there is genetic factors. That means the child is born with a tumor. It was certainly the fact in this diagnosis of the 18-month-year-old child with a brain tumor. So the other reasons that can come upon can be reasons that facilitate the emergence of the fact that cancer comes out on a child. That can be, of course, emotional. It can be all sorts of family history that comes out. Especially, I would think, what happens during the pregnancy is always very important when a chronic disease like cancer occurs in very young children.
Is it also your private way of thinking, or your philosophy, or is it more what you experience?
It's what I experience, definitely. Yeah. All the very young children that I have looked after and who have had very early cancer is this, and it's my own experience, but it's confirmed by other people who practice pediatrics. Early cancer is 90% genetical born.
And the birth factor?
The birth factor is also important. It's taken in account in the case taking, the conditions of what's happened during the pregnancy, even what has happened in the family surroundings before the pregnancy, of course the birth conditions, and the very early start of life. When there's separation, dislocation, there was a case where the father had left the mother 2 months after the birth. That, of course, is taken in account in the case taking of the child.
So I don't know if you said it today in your seminar, or if I would read it in one of your books. You said emotion can be very toxic.
Yes, that is maybe a very strong word, toxic, but it means what it means.
Would you please explain this a little bit further?
Well, I think in cancer there's a lot of I think I was answering to the toxicity also of the whole of the process. Toxicity of the treatments that are proposed straight from the beginning. And of course maybe I'm putting that back to the fact that the only really important fact that can be found in the etiology of cancer, apart from genetic, is emotion. And emotion is all the emotional events that the child has lived, that the mother has lived, are really important from the homeopathic approach. So toxicity, I would say, is try to see how strong it can be in the development of cancer in a child. I think it is separation, a father that leaves the mother 2 months after the birth. That's what I call toxicity. It's something very, very violent.
We both know that, but would you like to explain this a little bit further in terms of, as a physician, as a doctor, what do you think what happens in the body?
When there's an emotional... Well, that's what you have to analyze and understand what the type of emotion has occurred, and what exactly is the feeling that the child can have. For example, if you take the case of a separation, or a very hard grief of separation, what is the process in the mind of the child? It's interesting to know that for the phosphoric acid, the problem is the loss of communication. This is the deep meaning of the suffering of the separation. Loss of communication. It's one way to understand what has happened because of the separation. That's a good example to show you what is the process of the suffering of the child.
But, case taking, or maybe if you do a child case taking and you get the story of the mother and she has, just for an example, a lack of her mother and some really grief and big hurts, and if you would give the right remedy from the periodic table, did you see successes even in the child? I mean, that the mother could, you know, it would be always in their life, it would be always part of the life, but could come over it and then help coming over it, the child?
Of course, it happened, especially in acid situation. I have a few cases where, in fact, I treated first the child, and the mother came back and asked for treatment, and from the child prescription I had the mother's prescription. That is very often a practical scene, and in fact the child had opened the understanding of what had happened at the mother's level. It's very frequent.
So are you positive if the parents have big griefs or lack in the early childhood, and you can understand the remedy, that these can be healed?
I think it's very important.
It's very important.
But the first case I presented, I think the first remedy that was given to the child for his cancer was referring to the history of the life of the father, very early life of her father. So you see, it was applicated there in this case already. Treated the child from the etiology of the suffering of the father himself.
Yeah.
To be a star of fantasy. I want to reach the sun, but it's a dream. I want to be a star of fantasy. I want to reach the sun, but it's a dream.
Então, eu sou o Tércio Rocha, médico, tenho 45 anos, que depois que foi feito o exame, estava acusando ali uma leucemia. Com certeza não viajei para dar aula, né? Procurei especialista. Você tem 20% de chance. Nós temos que atacar bastante, porque o seu caso é bastante grave. E eu então fui para o tratamento, não querendo levar a vida apesar da leucemia, né? Ou apesar do linfoma. Levar a vida com o linfoma. Durante o tratamento, houve também momentos extremamente difíceis. Eu fiz choque anafilático à medicação, quase choquei 2 vezes. Tenho certeza que o fato de ser médico me fez contornar algumas situações que foram bastante difíceis. Eu sempre fui uma pessoa muito otimista. E então fui começar a quimioterapia. Hoje, quando eu vou para a quimioterapia, eu sempre coloco na parte do pé da cama, né, fotos dos meus filhos, fotos de eu andando a cavalo com eles, fotos de eu na praia com eles, fotos de eu atendendo no consultório, fotos de eu com a minha esposa, e fico olhando aquelas fotos e fico imaginando eu voltando àqueles lugares e brincando com eles. E quando você tem realmente boas âncoras na vida, como por exemplo o amor à família, faz com que você supere qualquer tipo de dor. Porque a superação é algo que nasce dentro e que mora em você. É uma capacidade sua, não vem de ninguém, não adianta pedir emprestado. A vida é um compromisso pessoal, inadiável, intransferível. Você tem que acreditar em você. São 9 anos de quimioterapia, mas eu não levo a vida apesar da quimioterapia. Eu levo a vida com tudo e sou extremamente feliz com tudo que eu faço. Deus fez o homem à sua imagem e semelhança para dar a esse homem a capacidade de acreditar que a vida vale a pena e merece ser vivida. E é nisso que eu acredito.
Okay, now we come to the cancer remedies. Now, what are these cancer remedies? This is wrong. We do not have such things in homeopathy. We do not. But for the purpose of teaching, but for the purpose of exchanging views, we can always talk about this. Certain remedies are more friendly with some diseases. So we have some more good friends, lesser good friends, very close friends. So we will be talking about smaller remedies which are very close friends with cancer. Now, what are these remedies? These remedies in advanced cases give soothing palliation. They help in reducing complications of cancer like pain and hemorrhage, etc. They open the way where possible for deeper remedies to work in future. They act at the localization of pathology. And in advanced cancers, they help reduce general intoxication. They are of great benefit for patients with complications of modern chemotherapy and radiotherapy. These remedies are almost always used in lower potencies and mother tinctures. They are often repeated. The potencies used are mother tinctures, D3, D6, C6 und 30C, because they work at the local level of pathology. Now, this is something very important. Our clinical experience, remedies with special affinity for different cancer pathology. Asterias rubens, breast cancer. The potency used is 30C and 200C. Breast cancer, advanced and ulcerating cancer of the breast. Aurum muraticum netronatum, cancer of the uterus and cervix. Normally the potency we are using at our center is day 6 and Sayed-Raisish. Baraita iodata, Hodgkin's disease and cancer of the glands. Hodgkin's disease, a grand remedy. Sayed-Raisish, say 200. Bismuth, cancer of the stomach. With vomiting, patient cannot tolerate even water in cancer of the stomach, is bismuth.